So this is a little bit different because I want to talk about a topic that is important to me and means something to me, but I'm at work and it's not a nursing related topic. I mean, technically I guess it is, but not really. It has to do with doctors or medical professionals judging you because you have a mental illness or a chronic illness, but especially mental illness. I feel like, because if you guys don't know, I have post-traumatic stress disorder, I have anxiety, and I've struggled with depression on and off throughout my life. So recently, when I started seeing this new MS specialist, I noticed that she wrote in my chart that I have, quote, psychological issues related to health. Now, when I asked her what that meant, she didn't really give me a straight answer. It was more of a, well, that's in your chart because you take certain medications, because I was taking Seroquel and a blood pressure medicine to keep my heart rate down so then I'm able to sleep. And it stops like the flashbacks and stuff while I'm trying to sleep. But because that's in my chart, everybody can see it. So if I go see another doctor within the same hospital system, or I'm in the ER or something like that, they can see that she wrote in there that I have psychological issues related to my health. So it's really frustrating because when you're trying to get somebody to actually listen to you and you're trying to get like good care and help, it makes it a little bit difficult when you have somebody who thinks that you have psychological issues because of what a doctor wrote. I feel like people, when they see something like that, they assume that you're faking your symptoms or your illness, or you are not being truthful, or you're just attention seeking, or you're drug seeking, something like that. And it irritates me that it is that way, because there's a lot of mental illness in the world, and I feel like there's not enough awareness and there's not enough like training on how to work with patients who have mental illness. And this is also true of chronic illness, like I was talking about, because a lot of people with chronic illnesses have multiple chronic illnesses. And so when people say that, they think that, oh, this person is just exaggerating, they want attention, because I have POTS, I have MS, and I also have epilepsy. So that's 3 chronic illnesses right there. So I don't know, it just makes it more difficult to try to communicate what you need to someone. I don't know. I mean, let me know if you think I'm wrong, but I just wanted to share, like, I feel like there's a lot of judgment when you have either chronic illnesses or, you have PTSD or depression or something, and someone puts that in your chart. In the past, I have, like, when people asked, I would tell them, no, I've never had an issue with depression or anything like that, but obviously if I'm staying in the hospital, they need to know that I have PTSD because of the medicine that I take for it. I used to take Zoloft and stuff for depression, but it wasn't really doing anything for me, so I stopped taking it. And I don't really notice a difference. I never noticed a difference when I started taking it to when I stopped taking it. But I just wish that we could get past the stigma of mental illness and just treat the person as a person and listen to their concerns. And if someone is telling you that they're feeling a certain way, don't just assume that it's psychological. Don't just assume that it's because they want attention. Don't just assume it's because, they're drug seeking or anything like that. Just listen to them, treat the symptoms, treat the person like they're a human being, like they deserve to be treated, like you would want to be treated, and just stop the judgment. That's pretty much all I had to say. So I'll talk to you guys in the next video.